Hey everyone, welcome back to the Neurologic Wellness Podcast. Today we are joined by Dr. Hannah Wadsworth of Axon Integrative Health as she talks to us about neuroacupuncture and what that is and who it helps. Thank you for joining us, Dr. Wadsworth.
Yeah, of course. Thanks so much for having me.
So I think I talked to somebody else in your office not too long ago, so gave a great presentation. So I'm very excited for what we have to talk about today.
Yeah, absolutely. Same here.
So can we just start by you giving us your kind of clinical story? How did you get into the field of neuroacupuncture? Um, yeah.
Yeah, absolutely. So I started out, coming out of chiro school, I was interested in acupuncture. And so I went through the certification process for that. So I'm a certified chiropractic acupuncturist as well. And with that, I wanted to kind of go one step further. And so, especially once we had the plans for us to open up a fully integrative clinic, focus a lot on neurological conditions, all of that, I started seeing stuff about neuroacupuncture and kind of dug into that. And so, just in the past about year, I would say, I started getting into neuroacupuncture, got certified in it, and have been able to start using it on patients and have been seeing great results with it.
Awesome. And I'm sure everybody listening by now has probably heard about acupuncture, right? So can you kind of walk us through what exactly neuroacupuncture is and how it might differ from acupuncture that patients are currently maybe aware of?
Yeah, absolutely. So with typical acupuncture, it's based off of the traditional Chinese medicine to where it goes based on meridians. And so with the neuroacupuncture, it's commonly called scalp acupuncture. It's only on the head. So with that, there's usually lines across that correlate to whatever lobes of the brain, whatever areas it's trying to directly affect. And so with that, you're doing maybe like 4 or 5 needles, much more minimal than traditional acupuncture, and it's directly over the site that you're trying to affect instead of being more distal like it is with going along with the meridians in traditional acupuncture.
Mm-hmm. That's awesome. So maybe patient is listening and they're like, "Oh my gosh, you're going to put needles in my head?" Like that sounds so scary. What can you say to them to kind of ease those worries?
Yeah, so it's definitely scary to hear starting out, getting needles anywhere most people aren't a fan of, but especially in the head, that definitely sounds scary. It's really not that bad. At most, there's a little poke with the initial needle insertion. Depending on if they're extra sensitive to the needles or not, I will use a guide tube typically, which will disperse that sensation so it's not so intense. They often don't even feel the poke at all. And with that, it's just parallel to the scalp. It slides in just a little bit, just directly under the skin in that in between layer. And so with that, usually they don't even feel it after the initial poke.
Mm-hmm. That's great. And how long do you typically leave the needles in?
It kind of just depends on the patient. I'll do anywhere up to like 20 or 30 minutes. Since it is flat against the skull, they can walk around and they can do any kind of neurorehabilitation exercises with it. So
Oh,
as long as
awesome.
they're fine ambulating, then they're fine to go through whatever exercises they were planning to do anyways in their visit. And
Mm-hmm.
those needles can stay there and there's no concern of them, poking themselves or hitting it on anything or anything like that. So it just kind of depends case by case.
Yeah, that's fantastic. Um, and what I guess you mentioned that you correlate where you place the needles to the lobes of the brain.
Mhm.
So is it just if I want to affect the parietal lobe on the right per se, I would put the needle kind of over where the parietal lobe sits in the skull. Is that right?
Technically, yes. More specifically, they're more so differentiated by what you're trying to affect.
Mm-hmm.
So there's like, for example, there's three speech areas. There's
Mm-hmm.
one for Broca's, Wernicke's, and there's another for motor. And so with that, you can affect any of those three speech areas by putting needles in those areas. There's an area for balance that's located in the back. And then you have across the top over the motor strip and the sensory strip, you have lines down there. You would go for motor or sensory depending on which area of the body. So if you're wanting to affect, for example, like the lower leg on the right side after a stroke, then you would do that on the left side in the foot area of
Mhm.
that.
That's amazing.
So they don't as much correlate it. I mean, they do correlate it to like the lobes or whatever areas you're trying to affect, but it's
Mhm.
more so based on what you're trying to accomplish.
Gotcha. And what are some of the things that well, before I ask that, um obviously the brain controls a lot, and we've talked a lot on this show about, the different ailments and issues people can have uh if they have certain brain injuries. But can you just touch on a little bit about broadly who might benefit from this type of care?
Yeah, absolutely. Really anyone coming in here with any kind of issue that they're trying to get taken care of at our clinic, they can be a good candidate for this.
Mhm.
Um, Anywhere from tremors to balance issues that they're having, vision disruption, um, even any kind of sensory disruption, post stroke, motor issues, um, vertigo, hearing, really anything we can essentially upregulate whatever treatments they're getting done here. We can upregulate it with the neuroacupuncture.
Awesome. Is there anyone that you would say isn't a good candidate for neuroacupuncture?
Um, I wouldn't necessarily do it on kids.
Hmm.
Not There's some research behind it, and it's taught that you can do it on kids. I personally don't, just
Hmm.
because I mean they're already not a fan of needles, so I'm not
Yeah.
gonna force them to get acupuncture.
Right.
But other than that, pretty much anyone can.
Okay. Awesome. Okay. And from your experience so far using it, can you tell our audience a little bit about some of the great things you've been seeing since implementing it?
Yeah, absolutely. I would say some of the biggest ones I've seen. Um, there was a patient I had a while back that had had a stroke and was having a difficult time opening her hand on the right side. And so we put the needles in on the left side in that area to affect the motor on the right hand. And, I put the needles in. She was one that didn't do any kind of rehab exercises during, just left her for a little bit, came back in. And whenever I walked back into the room, she held up her hand open. She was like, look at that. Haven't been able to do that in years. And
Wow.
so that was a super cool one that was very excited that she was able to just have that little bit of function. It's not something that's like a permanent one, just with one treatment, of course.
Hmm.
Um, but in combination with the other treatments she was getting, she was able to get some of that function back long term. With that, usually it's a treatment that they need to get at least a few times, while they're coming in for these treatments here, they need to be getting that frequently as well to get those lasting effects. But that was one that was a short term one that was pretty amazing to see. I also had a patient that was having a difficult time. She had aphasia and was having a difficult time just like formulating words, stuttering. She knew what she wanted to say, just couldn't formulate the words. And we did, I believe it was two treatments with her. And after the second treatment, she came back in and she was able to say a few sentences, as soon as she walked in, and you could see the look on her face. She was so excited that she was able to actually formulate those full sentences. So that was a cool one as well.
Yeah.
Um,
Those are
yeah,
that's amazing, and that's so life-changing for those people in what seems like such a short
yeah,
amount of time too.
absolutely.
And you did mention, it's not permanent right away. You
Right.
have to do it for a few sessions, depends on the patient, of course. But how long would you say that after a session results typically last for, and how many sessions do people normally should expect to gain those like permanent improvements from the acupuncture specifically?
So with that, it really depends. Typically here we don't do it just by itself. It's usually in conjunction with multiple different treatments here.
Hmm.
So usually depending on what they're coming in for, a lot of times we'll recommend like a 2-week intensive treatment.
Hmm.
for them for, post concussion, post stroke, anything like that. And while they're in for those treatments, we'll do the neuroacupuncture for, every day of the week while they're in for those 2 weeks. And typically they'll get at least some results that are lasting from that.
That's
Usually it's recommended there's some kind of maintenance from there afterwards. Um, as far as that, I haven't done as much of that because I've just focused on more of the intensive treatments,
mhm,
but that's also a possibility with it.
mhm. And then since your clinic is mostly intensive based, is that right?
To an extent.
To an extent. Is it very hard then referring patients to local providers? Is it something that's somewhat widespread throughout the country, the world, or is it kind of rare at this point?
Um, it really just depends. It's much more common with traditional acupuncturists.
Mhm.
They learn the scalp technique, I believe, in school, if I'm not mistaken. So there's a lot that know how to do it.
Mhm.
It's just a matter of finding one that will do it.
Gotcha.
But I have been able to find in the past, looking at based on areas that patients are living, I've been
Mhm.
able to find some that do it in their area
Okay. And in your practice, are you exclusively doing the neuroacupuncture
for the most part.
for the most part? Yeah,
Mhm.
that's great. And like you said, you can pair this with all the other therapies that you are doing in your office, which just leads to such a compound effect, and you would expect faster, more efficient results for that patient. So, can you touch on maybe, I know you kind of have already, but can you touch on, what a patient might experience when they walk through your office or walk into your office, I should say. It sounds like you're doing a lot with the acupuncture, you're doing the functional neurology. We talked with Dr. DeBeer, you're doing functional medicine and EMDR and all this great stuff. So I'm a new patient. I come into your office. What am I expecting? How am I expecting the testing to go in order to get me to be able to do all these amazing therapies?
Yeah, so usually, just on first visit, we'll have a full, if it's for anyone coming in to be treated with the neurology stuff, then they'll come in, they'll get the treatment with my husband, Dr. DeVere. He'll go through full exam the first visit, very thorough, very in depth. They'll do that for a couple hours. May start with some of the neuro stuff just on the first visit. Typically, we don't start the acupuncture until second visit, just until they've settled, they've done all this stuff the first visit. So they'll do that with me if they're interested in it. Usually we recommend it if they're there for an intensive, especially. Other than that, though, we do offer like packages and memberships here too. So if it's someone that's like not really looking for that in-depth treatment necessarily, they don't have, anything going on that's really concerning them. They're more just coming in for like wellness. They can do stuff like that. I will do acupuncture, traditional acupuncture, even if they're doing like a membership or a package or something like that. If they're coming in for something specific, then I'll go for more of the neuroacupuncture. But they're able to do that through any of our memberships if they would like. Other than that, though, with the functional medicine, we add that in, especially with the intensive treatments. So that way they have that option. We have IV infusions here as well. So usually we couple that with those treatments as well. Um, yeah.
Yeah, that's great. So many amazing things that you guys offer. How many people do you think are actually averse to the needles? I know you said a lot of kids have had a hard time, but is it usually a struggle trying to get people to do it?
Yeah, usually it's a struggle. People just aren't a fan of needles in general, which I
Mhm.
understand. I mean, even though I'm doing this every day, I still don't enjoy necessarily getting poked either.
Mhm.
Um, but typically people aren't, very fond of it initially unless they've had it frequently. I would say it's probably 70-30. 70% are like on board. They're like, yeah, go for it. If it's going to help me, let's do it. Then there's a 30% that are either like, no, absolutely not, no way, or they need a little bit of time to think it over. And then they get to the point where they're like, all right, let's go ahead and try it. Might as well.
Mhm.
So it's pretty rare that I see anyone that throughout the course of their treatment that the entire time they're like, absolutely no way, I don't want the needles in general. There
Mhm.
are some people, of course, but it's not as common for them to never want them.
Right. That's good. Yeah. Yeah, it's it can be scary, but it sounds like the potential rewards are worth the temporary discomfort, right?
Yeah, absolutely.
Um, and as far as going back to, you said you can kind of place them in spots that correlate with certain areas of the brain that control certain parts of the body, right?
Hmm.
So obviously you're not sticking the needle directly into that spot on the brain, right?
Right.
So how is it that it's translated where you put the needle in the scalp and then that then can stimulate that part of the brain that it's overlying?
Yeah. So with it, I couldn't give you the exact mechanism, to be honest.
Mm,
But the thought behind it is that with the needles, we are going in the areas directly over whichever area we're trying to stimulate. The traditional method has, lines you can draw with direct measurements. So you're getting over the right areas for motor, sensory, whatever you're trying to go for. And since you're putting them in under the skin, you're almost threading them underneath the skin, not down to the skull, of course,
mm,
but you're threading them over that area. The thought is that that's going to increase essentially the awareness over that area and the awareness of the brain in that area. And that's going to help upregulate it.
gotcha. And I assume you've done it too yourself, right?
Yep,
What
I
are
have.
what are some of the weirdest things or the coolest things I should say that you've personally experienced, if you don't mind?
Um, I haven't done any of mine, I guess I should say, for specific treatments.
Mhm.
I usually have done it more so, especially starting out for like practice, so I could get the right points, that kind of stuff, work on the technique more so. I haven't done it as much for treatment for myself. I should, but usually I was doing it more just for the practice of it.
Right, right. That makes sense. Well, this has been great so far. Is there anything that we haven't touched on yet about neuroacupuncture that you want to make sure our audience is aware of?
I don't think so. I think that's pretty much it. It's definitely been around for a long time, but it's something that's coming more to light in this field.
Hmm.
Very common, of course, Eastern medicine, but it's getting more so introduced with Western medicine and getting used more regularly with this kind of treatment, I think. So
Hmm.
I'm excited to see how it progresses and how it's more widely used.
Yeah, acupuncture in general has been around for thousands of years, right?
Right.
So, it seems like, we're starting to finally catch up with maybe the why behind or how it's working with kind of Western scientific methods. So, hopefully we can be
Yeah.
even more accurate with it. And
Yeah, absolutely.
yeah, but Dr. Wadsworth, can you let our audience know how they could get in touch with you and your clinic? If they were really interested in the neuroacupuncture and the treatments that you provide in your clinic.
Yeah, absolutely. So our website is axonintegrativehealth.com. We are located in South Denver. We are on Instagram and Facebook, and our phone number is 720-994-2966. We're pretty easy to get a hold of. But yeah, any of those ways.
Awesome. Well, thank you again for coming on today. This was super informative for me. I'm sure this was super informative for our listeners. I really appreciate it.
Yeah, thank you so much. This has been great. I appreciate it.
Of course. And this has been your host from the Neuro Wellness Podcast. Be well.